When we think about digital dentistry, I like to look at that through the flow of the patient coming into the practice as a new patient, which means how we then gather the patient information, how it's put into the computer management system for that patient file to be developed, how we're able to get information in the clinical area and be able to get it digitally in without having to utilize a lot of paper and that kind of activity. Then when the comprehensive evaluation is taking place, how we're able to gather digital photography and have that downloaded as part of the patient's record, from which the treatment planning and the presentation can take place. These intraoral and extraoral digital photographs, digital and stored in the patient's file digitally, is an important part of their record for presentation and for future development, because we want to store befores and afters of all the cases you do, because you never know which of those are going to be so exceptional that they will stimulate the interest with another patient, particularly when you have a signed form from the existing patient saying you can utilize these photographs for educational and publication purposes. So being able to have that information available, being able to move on then into that kind of a digital record increases case acceptance. Now, once case acceptance is done, in today's arena, we're going to be seeing more digital restorations provided. In other words, we're looking at CAD/CAM technologies that are just beyond belief from where we were 15 years ago. And we can then be able to have that kind of information for placement of restorations, being able to have the patient totally restored, not just for an individual tooth down, but for full arch type of reconstruction, where we can then have everything in a digital format, and then the records, the digital impressions, everything are stored in the patient's file. You have them then for a long-term record, so you know exactly where we're going with this patient. So, if we look at this then as a digital format of the future for dentistry, we're beginning with the new patient experience. We're actually the inbound call. We're looking at all of this information so we can actually record those inbound calls for learning purposes for our business team. We can look at the gathering of the clinical data, and that's a huge area. From that first call to providing the care, that area right in there is what we have to do. We have to be able to gather the clinical data we need, prepare it digitally, and store it in a digital record so we can retrieve that efficiently. Being able then to put it into that digital treatment plan that we're going to be able to show the patient and be able to have these photographs to present the case with. Being able to clear down to the point where they accept their financing of their dentistry, and a lot of that is done digitally now, where you can actually be able to have contact with these major healthcare financing institutions in a digital format, to where the patient says yes and schedule that appointment in the computer system for this whole variety of this whole gamut of time, getting down to where we then provide care. And now providing the care, much of that is done digitally as well. So I am looking at an environment in our profession that from the time I began 40 years ago until today will have had an evolutionary process that was unheard of in the past for dental history. And I think we all have a great opportunity here. It doesn't matter at what point you are in your career, accept the new challenge, move forward. Because if you're a young doctor, it's going to be the standard of care. If you're an older doctor, it's going to be something that has to transition. In other words, those people that are going to transition into your practice are going to want that kind of digital savvy. We have to look at this at all practices, regardless of your position in your career path.